John Bozica along with you. Day 2 of Healthcare Week here on 1480 WHBC as we come to you live today from OMNI Orthopaedics over in Belden Village on Balpar. If you don't know how to get here, it's pretty easy. You turn onto Everhard and then just drive out and you end up turning either right or left onto Balpar. It's really pretty easy to find. I mean, it's right up the street from where the Papa Gyros is down the street. And where Tamo Shinner used to be the other way, it's right up the street from that as well. So fairly simple to find. And we have our second guest here, Lisa Hazen, joins me right now. She is a registered nurse, a total joint nurse at OMNI Orthopaedics. Lisa, thanks for joining me.
Thanks, John.
So I asked you before we came on, and I'll ask you again now, but the term total joint nurse, I've never heard that before today. So I want to know, for those that are in the same boat as me, what is it exactly that you do?
Yeah, it could sound kind of sketchy if you lived in Colorado or Washington State, but I'm an RN with 38 years orthopedic experience working the floor and also case management. So this is more like a nurse navigator role. So I meet with patients having a total hip, total knee at the hospital ahead of time, so we can give them an education component, let them know what's coming at them, give them a little insight as to what would happen at their lengths of stay at a hospital, and then figure out their discharge plan and make sure we have like their therapy ordered for them, everything set up for them before they ever hit the hospital. They're all set for their discharge at home. So
in terms of the education that you do give them, I mean, how extensive is that? Like, how much do you teach them about it? How much do they end up knowing?
We usually do about a 1-hour session. I meet with about 4 to 5 patients at a time, bring them into our conference room, go over a PowerPoint presentation, and it's very open. Patients can ask questions. And then I sit down with them one-on-one afterwards to figure out who's at home to help them out at home, where would they like, what's their freedom of choice for therapy. We're, of course, hoping it's going to be OMNI, but we're open to other possibilities. And in that PowerPoint, I bring the model in so they have an understanding of what the surgeon's going to do during surgery. And a lot, their dressing care afterwards, the importance of dental prophylaxis afterwards. We also get into how to do their skin prep ahead of time and what they can actually expect to do during their length of stay at the hospital, which is so significantly shorter than what it used to be when I was a young nurse back in the Stone Age. So, yeah.
Well, and that's the thing that Dr. Pence and I were just talking about, too, is that I remember when, as I was saying, I was in, like, grade school, and my grandmother had her hip replaced, and she was in the hospital for, an extended period of time. She went to a rehab facility for an extended period of time, and it was probably a couple months before she got back on her feet. And he was telling me that sometimes 3 hours after surgery now, I mean, for someone in your shoes, one, how amazing is it that is transformed like that? And then two, I guess, what do you encourage then when they do get on their feet? What are the things you encourage them to do then?
Right. We found best practice. We get those patients up the day of surgery. Usually once the nurse checks them in on the floor, a physical therapist is knocking on the door to get them up, sit them at the bedside, let the cobwebs clear, make sure they don't have any nausea or dizziness, but then get them out for a walk. Best practice says if the sooner we get you up, the less likely you'll get a blood clot, have postoperative pneumonia, get your gut tract back on track, moving, and then they get to sit up in the chair for a short amount of time. It's just instrumental getting them up and getting them going, so we don't make them a sitting duck for these postoperative complications.
Now, has that then lowered the postoperative complications? Because I know someone in my family also had that happen as well,
Sure.
And I know that's a big thing, but I mean, how much lower is that? Like, if you could put like a number on it.
I don't know hard statistics. I can't really speak to that. But
Sure.
just, when it was like, used to be after a lady gave birth to a child, you keep them in bed for a few days. We were that way with our joints. And I'm talking early 80s, so how far we've come. And like you said, much less risk. The sooner we can get you up, the better. And we want to discharge them to home. That's where most patients feel the most comfortable. We really encourage them. This is the time you beat the bushes, get those family members out that want to help. Most folks have church family that say, if there's anything I can do, let me help. Let them cook you a meal. Let them drive you to a physical therapy appointment. Those kind of things. That's when you call out all the stops so that you don't go to a facility, especially during COVID. We'd prefer they not go to a facility when the pandemic's on. So, yep, get them home where they're comfortable.
It's the voice of Lisa Hazen. She is a registered nurse and a total joint nurse here at OMNI Orthopaedics, as that's where we're at for day 2 of Healthcare Week. Lisa, in what you've done in your 30 plus years of working, I guess, how have you adapted easily through all of this? Because there are tons of changes, it sounds like. So how do you keep adapting? How do you keep learning? And how do you make sure that every time that you have the conversation, you're up to speed on everything as well?
Right. I know that is the one constant in life. You can expect change. That's a consistent. I do have my orthopedic nurse certification, which means every 5 years I have to recertify, and that means I have to have 75 continuing education units, and 50 of those have to be within the orthopedic practice. So it does require you to keep current. I go to seminars, obviously not this year, but usually go up to Akron Children's annually and down to Ohio Health in Columbus, where you hear different physicians and nurses speak to the practice. And then usually about every 3rd year I try to make it to the National Orthopedic Association's program. But again, it was stonewalled this year. But yeah, trying to keep yourself current, reading articles and journals, absolutely. And bending the physicians' ears here. They're always bringing on new things all the time. So.
Well, and you mentioned COVID a couple times now,
Right.
too, and I know that's probably had a large effect on what you've done,
Sure.
what you haven't been able to do. But I asked Dr. Pence, why should somebody feel safe coming here? But, I guess I'll ask you, how is it that you feel safe doing your job?
Right.
And then in addition, how is it that somebody who's a patient here would feel safe?
Absolutely. A lot of it is the exact thing that your mother has told you since you were a little child. Good hand washing, covering your face if you're going to sneeze or cough. We do use the preventative mask here. We do hand wash. We have our cleaning staff religiously cleaning as well as spot cleaning during the day from any staff member. We all have sanitizer and wipes at our disposal. When I do meet in the classroom, of course, we clean in between uses, but our patients are encouraged to wear a mask. We certainly wear a mask to just help produce or reduce that risk. So, yeah.
It's been an interesting time for the healthcare field. I know
Absolutely.
that everybody's had to adapt and everybody's had to change, and I'm sure that makes day-to-day life pretty stressful, doesn't it?
I try not to let it be.
Sure.
But it is different.
Yeah.
Different's a good word. Yeah.
No, I've wondered about that. I've wondered how much it's affected the life of somebody who's been in it for a while. Because
Yeah.
there hasn't really been a pandemic like this in our lifetime. So
Yeah.
it has really changed things. Lisa Hazen, total joint care nurse here at OMNI Orthopaedics. Thanks for joining me.
Oh, thank you.
I
My
appreciate
pleasure.
the time. Absolutely, I appreciate the time, and I learned a couple things today. So that's the key. I'm trying to educate myself too with all of this. So Lisa, thanks for joining us, and when we come back, we'll have Dr. Kelsey O'Connor. She is a board-certified physician specializing in physical medicine and rehabilitation and pain management. That when we come back on WHBC.